Braden Brown now joined by Dr. Jennings from HSHS, St. Anthony Memorial Hospital. Good morning, Dr. Jennings. How you doing today?
Hi, I'm great, man. Thanks for having us on.
Yeah, we appreciate you joining us once again. Obviously, this COVID-19 thing isn't going away anytime soon. Got any updates for us?
Boy, I think everybody's probably watching the news pretty closely and seeing the number of cases continuing to rise. Like we talked about, I think, last week, the primary population that has been affected seems to be a younger population, which has not turned into the hospitalizations and the mortalities and things like that that we concern ourselves so much about. But still very concerning, especially as we work towards bringing kids back to school and the implications of that, and just trying to keep that most vulnerable population as safe as they can be.
And you talked about school. Tomorrow, the IHSA will probably make a decision on if we'll have fall sports this year. What's your thought process on what they should do and what you think they'll do?
Carefully stated. So one's stay out of the politics, and I honestly suspect that there'll be a stop on it. I don't think they'll move forward with sports. If they do, it'll probably be in some limited environment with decreased fans and spacing people out, and kind of what you've seen in other large venues in order to continue the idea of social distancing. I do know that when you look at the grand scheme of things, if we at the end of the day want to continue to slow how many people get this disease at once, and that's really what the name of the game has been. It's not so much that we figured out how to completely prevent the disease, it's that we're trying to figure out ways that only a smaller fraction of the community has it at any given time, so that you don't overrun healthcare resources. In that environment where you acknowledge the idea that some people are going to get it no matter what, but you want to control the number of people, then that type of a strategy makes a ton of sense, to restrict athletics and number of people in the stands and of course, just close contact. I think Major League Baseball obviously had a significant event within the teams themselves, and
right.
So it's very real, and so trying to do that in a way that makes sure that, again, that we don't end up overrunning the healthcare system. Now, big picture, the more people that presumably get the disease at some point and then are immune, which we're assuming, which we just don't know, but if we assume those people are immune, eventually that's helpful, because you've had more people that have had the disease and then they are not going to be spreading it from person to person. But there's a really big unknown gap in here between where you start to get a lot of quote herd immunity from where we are right now. So long way again around the story, but reality is I think that it's likely that they won't move forward with allowing us to have that level of close contact in the fall. But hopefully, if they can come up with a way to do it and do it safely with the distancing rules and those types of things, we can still enjoy some athletics, but maybe in a way that we never have in the past.
Right. Obviously, that's not the answer anybody wants to hear, but COVID-19's here, and it's a real thing, and we got to, watch out for it.
Absolutely. I'm counting on the media. You guys can come up with a great way for us to still enjoy these high school sports without necessarily being in the stands. I'll put it back on you. How's that?
Gotcha. Another question for you, Dr. Jennings, as you join us here on 95.7 WCRC. Say there's multiple businesses underneath one roof. They come in through the same doors. They share bathrooms. What do you recommend if someone tests as positive for COVID-19 in one of the businesses that's in the same building, but it's not your department?
Wow, remarkably challenging. Yeah, obviously there's a lot of just legal implications in that, but the good news is that limited contact, limited exposure is not that big of a deal. We know that casual contact, you're not likely to acquire the disease, in any severe way, or at all for that matter. If you just have casual contact. Now, sharing a restroom, gets to a higher level, which goes back on the businesses and things like that to be thinking about high-level disinfection, where they're routinely cleaning those common areas, with a sanitizer type thing, bleach-based or alcohol-based, whatever, soap and water for that matter, to routinely clean those common areas, because again, if you share space with multiple independent groups, you don't necessarily have control over what's going on in that individual business. So the best thing that you're going to be able to do is to control the common areas and make sure that those are cleaned appropriately and maintained in a way to keep the worker safe, so that if there is an exposure, or if there is someone that's positive, the likelihood of cross-contamination from a surface is minimal.
All right, Dr. Jennings, you say it every week. Wash your hands, wear face masks. You got anything else for us?
Boy, those are the big two, and I continue to want to reinforce the idea that what we don't want to have happen is we tick up our prevalence to the point that we have to go backwards and we get a mandate that shuts down our businesses, because that's going to be devastating in ways that are not even measurable by the disease itself. So we need to be very responsible around this, primarily for that purpose, and of course the well-being of those involved, and looking out for the elderly and the immune compromised. But we sure don't want to end up in a situation where we're shutting down our businesses again. So mask, and that hand washing's key. As I said before, my grandma had a sign as you walked in the house for 50 years that said "Wash your hands," and she was 50 years ahead of the story. So.
All right, Dr. Jennings, we appreciate you joining us once again, and we'll see if we can talk to you again in the future.
I sure look forward to it, and thank you guys and WCRC for getting us on.
Yep. Thank you, Dr. Jennings.
Bye-bye.